After hernia operation, what sort of diet is recommended for these patients? Are there any major restrictions in diet, or should they avoid certain foods to improve healing? So there are a lot of dietary myths among our patients when it comes to recovering from a surgery. So there are a lot of people who feel that they should not take certain types of pulses, they should not take certain non-veg, and there is a chance of infection if they take certain diets. There is no major dietary restriction after a hernia operation. The hernia operation is done on the abdominal wall, on the muscles of the abdomen. We generally do not touch or tackle the intestines or the digestive tract in a hernia operation. So we advise patients to take a very high protein diet because we need the tissues to rebuild, we need the muscles to rebuild, we need a good recovery of the muscle strength after hernia operation. So they are advised to take high protein diet. For vegetarians, they are advised to take alternative sources of protein or even a protein supplement. There is no restriction on taking non-vegetarian diet or meat after a hernia operation. They must take adequate fiber because after hernia it is always advisable not to have constipation. The stools have to be kept soft. So they should be encouraged to take adequate fiber and adequate fluids. There is as such no food item which is restricted or to be avoided after a hernia operation. Dietary advice may be different for a patient undergoing some other operation on the intestine where we have specific dietary charts made for them. But as far as the hernia surgery is concerned, you need not worry, you are free to eat whatever you want to eat. Make sure you take adequate protein, adequate fiber and good amount of fluids.